Good afternoon, ladies and gentlemen, and welcome to the Tuesday, January 30th, the year 2024, the edition of our Health Subcommittee. Ms. Adams, could you please call the roll?
Representative Jernigan?
Yep.
Representative Leatherwood? Representative Martin? Here. Representative Mitchell? Here. Representative Sherrill? Here. Representative Terry? Here. Representative Williams? Chairman Hawk?
I'm here.
You have a quorum.
Chair detects a quorum. We will begin today. Before we start, any personal orders from any members on the committee? Seeing none, we will go ahead and take care a bit of housekeeping on our calendar today. We have a few items that were rolled to from last session to the first calendar of this year, and we'll be taking those off notice. So if you could follow along with me. Item number 1 on our calendar, House Bill 1457 by Leader Cochran is taken off notice without objection. House Bill 1143 by Representative Fidel is also being taken off notice without objection. House Bill 1146, also by Representative Vidal, is being taken off notice without objection. House Bill 242 by Representative Hale is also being taken off notice without objection. We will roll on to the calendar. Item number 10 on our calendar today, House Bill 1701. Action has already been taken on that by Chairman Williams. That has been withdrawn on the House floor. So we will not take up item number 10, House Bill 1701. Action has been made to withdraw. We do have a full slate of business before us. Before we begin, we've got gentlemen keeping us safe today, a new face for this committee. Anybody walked around? We got Lamar Gordon walking around the back of the room. Lamar, welcome. We're glad to have you here as a Sergeant at Arms. So let's give Lamar a round of applause. And also for this week, we've got a young lady, Anna Yankee, is filling in from the clerk's office. So she's with us today as well. So welcome, Anna. Give her a round of applause. Thank you so much. Ladies and gentlemen, we do have a calendar before us, and we are now on item number 5, House Bill 1625 by Chairman Zachary. Chairman Zachary, you have a motion to second. You're recognized, sir.
Thank you, Mr. Chairman and committee. Members, this legislation is going to look very familiar to you. Last year in special session in August, this legislation passed out of the committee, went to the House floor with overwhelming bipartisan support, passed. This legislation, as a reminder, was brought to me by Covenant parents after the tragedy we experienced in our state last year related to duty to warn. As you know, right now, the way the statute is written, it's very vague for mental health practitioners. If a threat is made during one of their sessions, right now the statute only says that if a specific threat is made to a clearly identified victim, that is the only reason given for a mental health practitioner to report that. The challenge with the statute is very vague and did not even tell them where to report. So what we've done with the help, again, of Covenant Parents 2 in particular, who are attorneys that worked with me on this legislation, we have specified this language and increased the requirements, meaning that if a threat is made to related to a group of people related to a school, related to family members of a patient, then that mental health practitioner is required to take action to either report that to law enforcement if they see it as an immediate threat, or to 988 or their local health facility if they think the person needs to be evaluated. So with that, Mr. Chairman, I'll rest. Again, won't belabor the point because this committee has already heard that explanation. And then let me also point out, it was brought to my attention last week by the Behavioral Health Foundation that the last sentence of the original statute, for whatever reason, had been left out in our drafting of this. And so I just wanted this committee to know I've already got an amendment drafted. I just did not have time to file it because it would not have been timely filed. That if this committee chooses to move this on, that will be on the bill when it goes to full health. We're glad to take questions.
Thank you, Chairman Zachary. Chairman Terry, you're recognized.
Thank you, Chairman. Just can you summarize what we passed last in special session versus this bill? What little changes have been made in that?
Thank you.
You recognize Chairman Zachary.
Thank you, Mr. Chairman. Chairman Terry, they're the exact same. It's the same language. I'll have an amendment again that it wasn't brought to my attention during special session, but I'll have an amendment brought next week that actually puts back in the last sentence of the original statute, but that for some reason had been left out. That was not my intent. But in terms of what we passed in special session on the House floor, this is the exact same language.
And
Chairman Terry.
and what was that last sentence? Do you remember?
The last sentence, you know what? Look at this bipartisanship from Bo Mitchell. That last sentence is likely to carry out the threat unless prevented from doing so. So thank you, Representative Mitchell. So it was brought to my attention by the groups here in the state, by the Behavioral Health Foundation, that particular sentence gives some flexibility to the mental health care practitioner, that if that patient is immediately committed or they take action to stop that patient from taking those steps, then that satisfies this.
Just one more. And the professionals are supportive of this?
Yes. Yeah. Actually, this bill, even before that language, was endorsed by the Tennessee Psychological Association. Yes, sir. Thank you.
Okay. Thank you. Chairman Williams, you're recognized.
Thank you, Chairman Zachary. Like your bill, liked it in special session too. Unfortunately, the other chamber decided not to work, but I appreciate your efforts here. My question to you is, if you add that language though, well, I guess maybe I should ask this in the amendment, but how would that change someone's decision whether or not, how they would know whether someone was likely or not?
Yeah,
Chairman Zachary.
Yeah, thank you. Good question, Chairman Williams. So what we did here is we made sure throughout this legislation is that we put that the mental health care practitioner must use reasonable skill, knowledge, and care ordinarily possessed by exercising their professional skill. So we're literally relying on the mental health professional to take those steps, and putting that last sentence back in, which again should not have been taken out. If they actually go ahead and commit the patient here, then there's no need for them to call law enforcement or 98, because that literally they are already taken that step.
All right. Thank you.
Yes, sir.
Thank you. Any further questions, comments? Representative Mitchell, you're recognized.
Yeah, Representative, and I thank you, Mr. Chair. I appreciate you putting that last sentence back in. I think without that last sentence, it would have a chilling effect on people seeking help, and we don't want to do that. So I appreciate you getting that amendment.
Yeah.
Thank you.
Thank you.
Thank you. Further questions, comments? Are you ready to vote? All those in favor of sending House Bill 1625 to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward.
Thank you, Mr. Chairman of the committee.
Thank you, Chairman Zachary. We're now up to item number 6 on our calendar, House Bill 1639 by Chairman Moon. I know you've got a committee going on yourself right now, so thank you very much.
Thank you, Mr. Chairman.
We have a motion. We have a second. You're recognized, Chairman Moon, on House Bill 1639.
Yes, sir, Mr. Chairman, and I do have an amendment. It's Amendment 12324.
You've heard we'll go ahead and put the amendment on the bill. Motion and a second on drafting code amendment 012324. All those in favor of placing this amendment on the bill, please signify by saying aye. Aye. Any opposed, please say no. The ayes have it. We are now on your bill for you to explain as amended.
Thank you, Mr. Chairman. And this bill originally dealt with hospitals releasing records next to kin. Nursing homes and other people under Part 2 of this chapter found out and really came and begged to please add the same language. So patients retain the right to keep their medical records private even after death. HIPAA leaves the definition of personal representative up to the individual state law. A decedent's personal representative is an executor, administrator, or a person who has the authority under applicable state law or other law to act on behalf of the decedent or the decedent's estate. In Tennessee, the only statutory definition of personal representative is a person who has received legal authority over the decedent's estate. However, oftentimes the widow or widower or next of kin may require medical records, and probate of the estate is unnecessary through estate planning, or the decedent's remaining assets are often too small to open and close an estate. Hospitals receive requests for the decedent's patient's medical records from the patient's next of kin or from attorneys providing HIPAA authorized forms signed by the patient's next of kin, but to remain HIPAA compliant, those requests legally have to be denied. Under Title 63, Chapter 2, 101, the authority of the next of kin to receive the patient's medical records is provided, but that only covers professionals of the healing arts. It does not provide this for hospitals, which is under Chapter 68. So what I'm asking is that we could take the language that is in Title 63 and bring it to 68. So hospitals can, and nursing homes, the part that was added in this amendment, can release that to the next of kin. If there's not a problem, if there's in probate and that person's been authorized by the court. The problem is where the next of kin needs these, and they shouldn't have to be sent to engage an attorney and go file, especially when it's at a time that's very stressful in their life.
All right, thank you, Chairman Moon, very much. And just to clarify, the amendment we put on extends this same privilege to the nursing home industry as well. And the bill comes from you from Blount County Memorial Hospital, but affects all. And now we're including the nursing homes as well. Is that correct?
That's correct. And freestanding surgical clinics, anything that's in Part 2,
Gotcha.
because in order to settle insurance claims and get these bills cleaned up, and a lot of times these people have durable power of attorney or power of attorney, and they don't realize that goes away at death. And they get really frustrated and upset when they can't get these records.
Thank you. Thank you for the explanation. Any questions, comments from members? Seeing none, are you ready to vote? All those in favor of passing House Bill 1639 by Chairman Moon on to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you, Chairman Moon. We're now ready for item number 7 on our calendar. House Bill 1679, I believe, is being carried by the good Representative Martin. Representative Martin, you have a motion. You have a second. You're recognized on the language of House Bill 1679.
Chairman,
Do we have an amendment on this legislation as
do.
well, sir?
we do, and the amendment makes the bill.
I'm looking at drafting code 012761. Is that accurate, sir?
Yes, sir.
All right. We have a motion. We have a second. Let's go ahead and put the amendment on so we can discuss the bill in its final form. All those in favor of placing drafting code amendment 012761 on the bill, please signify by saying aye. Any opposed, please say no. The ayes have it. We are on your bill now as amended, sir.
Okay, this bill, thank you, Mr. Chairman and committee. This bill is going to allow more access for dental hygienists that would be serving in our state in municipal, county, and state health departments. Currently, we have 8 counties that don't even have a dentist. And so this would make it where a dentist would not just be able to supervise 3, but 5 dental hygienists. And I'll be glad to answer any questions.
Thank you. And I will ask or add, I believe there's also a caveat within dealing with mobile dental services. And I know in my neck of the woods, there's a Miles for Smiles that will have a full service dental unit in a tractor trailer. And I think that actually will extend to 10 hygienists who can work under the supervision of one dentist in that instance, I believe is also a part of
It is.
part of the legislation as well. So thank you.
Mhm.
Chairman Terry, you're recognized for question or comment.
Yeah, I just want to clarify that dentists in private practice, they're still at 3, but this is for state Department of State Department in that or in the mobile clinics. That's all it affects.
That is correct, but it would also extend to metropolitan health departments and county health departments.
Right. Okay.
Thank you. Any further questions or comments for the sponsor? Seeing none, are you ready to vote? All those in favor of sending House Bill 1679 to full health committee, please signify by saying aye. Any opposed, please say no. The ayes have it. Your bill moves forward. Thank you very much. We are now on item number 8 on our calendars, House Bill 1683 by Representative Burkhardt. Representative Burkhardt, you're carrying this for Leader Lamberth. You are recognized on the bill. Any amendments on your legislation, sir?
No, sir.
I do not see any. Sir, you have your motion as second. You're recognized on House Bill 1683.
Thank you, Mr. Chairman. This is a cleanup bill from the administration. Back in 22, Congress passed the Consolidated Appropriations Act of 2023, and it's signed into law and also in 2022 in December. And this removed the Drug Addiction Treatment Act, or DATA. And this is just cleaning up Tennessee code to correspond with that. And this is an administration bill, and data waiver is we're just going to take data out of the Tennessee code. This bill has no physical impact, and I have some ladies from the department that are here if the questions get too complicated, but I will try to answer any questions that I can. But Chairman.
Thank you, Representative Burkhardt, very much. And I understand the legislation is just removing some obsolete references that because federal law has changed, we need to remove from state law as well. Is that accurate?
That is correct.
And it's not doing nothing in terms of what reporting we're going to get on buprenorphine and
No.
Suboxone and all those other byproducts of
No,
that,
sir.
correct? Okay. All right. Any question has been called without objection? All those in favor of sending House Bill 1683 to full health committee, please signify by saying aye. All those opposed, please say no. The ayes have it. Good job. Your bill moves forward.
Thank you, Mr. Chairman and committee.
Thank you very much. We are now on item number 9 on the calendars. House Bill 1669 by Representative Bain. Representative Bain, you have a motion? You have a second. You are recognized on House Bill 1669.
Thank you, Mr. Chairman. So this bill is the daycare closing notice bill that stipulates that childcare establishments must give 60 days notice to parents and guardians of enrolled and waitlisted children before permanently closing their doors. The lack of accountable daycare is a problem for Tennessee families. In addition to all these hoops, these facilities, which have struggled to keep up with Tennessee's booming population, can close with little to no notice, leaving families scrambling. Constituent Tyler Brasher from Donaldson was on a wait list for 10 months before being accepted. This summer, his child care's facility gave them 6 days, not weeks, notice before it shut down. So who does this hurt? Everyone. Families, companies, and most notably children have to deal with the unexpected consequences of sudden facility closures. The knock-on effects of losing access to childcare with no notice are huge. Most families rely on both parents working. When daycare access is suddenly removed, at least one parent must stay home from work to care for the child. Ensuring that working Tennessee families have access to quality and accountable childcare is a bipartisan issue. It should be a parent's choice rather than the parent waking up and not having a choice of where to send their kids. And finally, accountable daycare providers is a workforce development initiative, as over 80% of working parents reported employment disruptions due to inadequate childcare, citing affordability, quality, and access as significant challenges. Many reported recently quitting, being fired, or turning down a job offer or promotion due to childcare problems. So, if a daycare has advanced knowledge that financial distress is going to force its closure, the family should be provided notice beforehand sufficient to allow them to find alternative care. Thank you, Mr. Chairman.
Thank you very much. Appreciate it. And childcare is an issue that's been discussed in this committee and other committees for quite some time. So thank you for bringing the issue to light. Any questions or comments on the legislation? Chairman Williams, you're recognized.
Thank you, Representative. In the instance you gave earlier, 6 days, my assumption is that from a cash flow perspective, that business couldn't operate, which is why they shut their doors. In the instance, if your bill were to pass, who pays for the other 53 days for them to be open? Would the state do that, or would that practitioner have to charge more for daycare services in order to keep it open to meet the 60-day notice?
Representative Bain, you're recognized.
I'm not sure about cash flow issues because this bill has to do with an administrative policy protocol in terms of sending a letter.
Chairman Williams.
What I'm saying is if in the instance you gave as an example, there were 6 days notice, I think, given. Obviously, they got that business, that private business, gave that notice 6 days. Your bill says it would be 60 days. My point is if they don't have the resources to operate their business in order for that additional 53 days, how do we keep those businesses open?
Representative Bain.
Once again, the burden falls on the provider. This is merely a letter to be sent by DHS. I'm sorry, from the provider to the parents, notifying them of the closure, not the shortage of the financial distress.
Yep. I guess my concern with your bill is that I recognize the fact that this is a private business. They're licensed by the state in order to provide daycare services. But at the end of the day, we're telling a business how to operate their business because they would have to know what happens if, for instance, if they lost half the number of kids who decided to leave, they didn't have a waiting list like the example you gave. They'd have to keep their doors open even without any kids in them for 60 days. Would they not?
Representative Bain.
Once again, sorry, it's an administrative request that DHS adds this to their guidelines, as in fact, they have a similar law in place, which is the notification of changes to a program description shall be submitted 10 days prior to making a change with regard to a notification requirement for change of ownership for a daycare facility. So I'm merely adding another administrative request.
Chairman Williams.
Then why not use 10 days? I guess I wonder why you're...
The days. Okay. For working Tennessee families, 10 days is not enough notice. The reason I chose 60 is because a lot of reporting requirements for DHS fall within either a 10-day, 60-day, or 90-day period already. And so they're already acclimated to these types of thresholds.
Thank you.
Thank you. Representative Mitchell, you're recognized.
Thank you, Mr. Chairman. Does the daycare have to have knowledge that they're closing before they're required to send this notice?
Representative Bain, you're recognized.
Thank you, Chairman. So as the legislation is written, permanent closure is defined as the cessation of all child care provided by a child care agency with the intent to discontinue operations indefinitely.
Representative
Okay. Sorry, Chair. So back to his situation, I think what he's getting at is, they just don't know sometimes. So I think, if I think it's probably needing an amendment that says they would have to have prior knowledge of this beforehand, before this stipulation kicks in. So with that being said, Mr. Chair, I'd like to make a motion to roll this 2 meetings, if that's okay with you, sponsor.
Sure.
Second.
Okay. We have a request to roll. We'll go. Chairman Terry is on the list, and Chairman Williams has asked to be recognized as well. Chairman Terry, do you want to be recognized now? Withdraw. Chairman Williams, you're recognized.
Thank you, Chairman. Representative, my issue is not necessarily to impugn your bill or what you're trying to do. I think the concern I have, your colleague on the other side of the aisle and I are working on a TASER study to study this very thing as it relates to education, or as to pre-K and daycare across the state. TASER is going to be doing a study to do that, of which I sit on. This is a really important subject, but sometimes when you pull one lever, another occurs. I'm happy to talk with you outside this committee room, and I know as all the members would be happy to talk to you about it. But this is really the first discussion that we'd had. It was not my goal to impugn the representative's first bill that I've heard. And so, but I do think it does need some work. And so I agree with the representative from Nashville. Thank you.
And as we're discussing the role, I will go to Chairman Terry as well.
Thank you, and I appreciate and I was going to suggest rolling the bill or taking it off. No, something for some work on that, because I did have several questions on this, and we haven't had our first health meeting, and I usually, and you did a great job on your letter that you sent to everybody, and I usually ask anybody that files a bill for the health committee to actually fill out a process sheet that we go through on that. And a lot of that's what are the unintended consequences that we have is one of the last things I ask people. And so if we decide to roll this, again, we'd be happy to talk to you and kind of see what issues we may resolve so we can get it finished in this committee before we send it on or whatever we do with it. So thank you.
And Representative Bean, I would ask if other members have some topics on this issue that they would like the representative to consider in the mandatory language or potential considerations as we move forward. I would encourage us to all, Representative Bain, reach out to the members that you've heard from on the committee and seek out their input. I will mention as well a concern that popped in my mind, and as I'm listening to debate, what if the unfortunate death of a child care provider occurs, and in that moment, they're a integral part of that business, and because they've passed away, they can no longer provide those services. What happens in that circumstance? So I can hear several ideas that are bouncing around to try to help your bill do better and make more sense and address some of the issues that we've heard today.
Okay.
The suggestion has been to roll this bill for 2 weeks. I'll look at the chair and the members. Without objection, we will roll House Bill 1669 for 2 weeks.
Thank you.
Thank you, and good job on your first bill, Representative Bain. Chairman Terry. Before she leaves, Representative Bain. Chairman Terry, you're recognized.
I just want to point out something that, from a constructive standpoint, last year I had a bill in a subcommittee, and happened to me too. Had to take it off roll, so it happens to all of us. So
you
just
so
wanted to
much.
let you know. Thanks.
It wasn't his first bill.
Yeah, exactly.
Thanks.
Chairman, if I had to count the bills that I've had to do that to, we'd be here all day long. So I'm in the hundreds of bills that I've had to do that to. So thank you very much for your construct. As we stated, item number 10 has been withdrawn, and I'm going to pass the gavel down to Chairman Terry I will be recognized on item number 11 on our calendar. So.
All right, we are on item number 11, House Bill 1678. Chairman Hawk, you're recognized.
Thank you. And I'll make a motion for
Okay,
it.
you have a motion and a second. Do not see any amendments.
There are no amendments.
Okay, you are recognized on the bill.
Thank you, Mr. Chairman. This is a bit of cleanup legislation that we have to do from year to year. When the House Bill 1678, when the Health Facility Commission separated from the Department of Health, the reporting of hospital discharge data was inadvertently transferred as well to the Health Facilities Commission. This proposal transfers that reporting data back to the Tennessee Department of Health. Additionally, this bill will add collection of discharge data from birthing centers so that the department can analyze additional information about births occurring at this type of facility. Birthing centers, their usage is becoming more and more prevalent, and that's some important data for us, for the Department of Health to have on board as well. Additionally, this bill deletes the requirement that hospitals that have shut down submit a final joint annual report to the department. This is a suggestion of the Comptroller's Office when these hospitals have closed for financial reasons, and that's essentially what the joint annual report tells us. it's hard to find the folks to file this report once they've closed. So at the suggestion of the Comptroller's Office, this is a part of that legislation as well. Chairman and members, that's what this bill does.
Okay, do we have any questions for the sponsor? All right, question has been called. All those in favor of House Bill 1678, say aye.
Aye.
Opposed? Ayes have it. Bill goes on to full Health Committee.
Thank you, Chairman and members.
Thank you so much.
Big D, that looks good on your hands there,
You
my
got one,
friend.
don't you?
Ladies and gentlemen, we have completed our calendar. Any further business to come before the committee? Seeing none, we are adjourned.